Did you know that Medicare premiums, co-payments, co-insurance, formularies, networks, and benefits often change each year? October 15th through December 7th is Medicare's open enrollment period. On this episode of Aging Insights, we'll explain why you want to review, change your plan, and how to avoid scams. Welcome to Aging Insights. I'm Dr. Kathy Rowe, Executive Director of New Jersey Advocates for Aging Well. Our guest on this episode is Charles Clarkson, Project Director of Senior Medicare Patrol of New Jersey. Thank you for joining us today, Charles. It's always a pleasure to have you here, and it's that time of year when we talk about Medicare and open enrollment. So let's start. Can you remind our audience what Medicare is, who's eligible, and a brief explanation of what Plan A, Plan B, Plan C, and D are?
Well, for most people, Medicare is the federal health insurance program.
Mm-hmm.
We're not talking about Medicaid, which is usually a state-run program,
Right.
even though it's funded by the federal government. So Medicare, for most people, happens when they turn 65, and they've worked at least 10 years during their life,
Mm-hmm.
and they can enroll in Medicare because they get Part A for free if they work for 10 years. Part A is the inpatient hospital coverage.
Okay.
Part B is your outpatient coverage, such as x-rays, doctor's visits, lab tests, things like that, and you pay a premium for the Medicare Part B, and this year it's $148.50. They haven't announced what the premium is going to be for next year.
Okay.
And then you have Part C, also known as Medicare Advantage plans, and we'll talk about that in some detail. And then you have Part D as in dog, which are the drug plans, the standalone drug plans that are offered by private companies.
Okay.
And that's Medicare in very, very broad terms.
Okay. And the premium, is that a monthly premium?
Yes, it is.
Okay.
It's a monthly premium. And there are programs for people with low income called Medicare savings programs, but you would have to check with your state and see if you qualify for these Medicare savings programs.
Okay. So can you remind our viewers, what is open enrollment, and when does it start? What does it end?
Okay, well, today is the perfect day to talk about it because today is October 15th and the start of open enrollment. And it goes through December 7th. That means every year people on Medicare, whether you're on original Medicare or a Medicare Advantage plan, can make changes.
Okay.
So if you're an original Medicare and you see the Joe Namath commercial and you say, I can use some of those Medicare Advantage benefits, you can switch to a Medicare Advantage plan. If you're already in a Medicare Advantage plan, you can change Medicare Advantage plans. Or if you're in a Medicare Advantage plan and you say, these networks of my doctors, they're not in the networks, I have to pay a copay every time I go, it's just not worth it. I want to be able to go to any doctor and it's a Medicare. I can go back to original Medicare. But then you have to be careful because remember, if you're an original Medicare, most people buy a supplement plan.
Okay.
So using myself as an example, I'm an original Medicare and I have the Medicare Supplement AARP United Health F plan because at the time I liked that plan. It was the best plan available, and I enrolled in a Part D drug plan.
Okay.
Now, a lot of people over the years, that supplement plan can get expensive. So they say, I can no longer afford this. I'm on a fixed income. I see the Joe Namath commercial. I can use those benefits. They can switch over to a Medicare Advantage plan. Just remember that there's a network. There might be other rules they have to follow. But every year, people really should review their coverages. Because I have found that, and I read statistics, that less than 5% even consider making changes.
Really?
Yeah, it's really not good for them. And I'll give you a perfect example. So if I'm in a drug plan, every year I sit down and I put my drugs in. And I compare drug plans. In the last 2 years, I've changed Part D drug plans because I could save money, get all my drugs covered. Why should I spend more when these Part D drug plans are approved by the government? So I know they all work pretty much the same. So that's why you have to do a comparison. Because if you don't, you could be surprised when you go to your prescription to fill your prescription. The pharmacist might say, did you know that this drug has been dropped from your plan? And you say, no, I didn't. Oh, don't worry, I'll pay out of pocket. Well, when the pharmacist says, well, that's $300 for a 30-day supply, you say, oh my God,
Yeah.
you made a mistake.
Right.
You should have did a comparison and made sure all your drugs are covered, what the cost is for the entire 2022. Remember, it's not just the premium. It's the total drug cost.
Right.
Plus the premium. And the Medicare site, which is medicare.gov, has a plan finder called, you can look it up, it says Find Health and Drug Plan. It takes you to the plan finder. There you can compare drug plans and you can compare Medicare Advantage plans. So we encourage everybody to do that. Now, I know that a lot of people are not comfortable on the computer, and they would find doing this research on the Medicare Plan Finder difficult.
Right.
So there's a great program in every state. New Jersey has one called SHIP, State Health Insurance Assistance Program. And in some states it has different names, but basically it's a health assistance program in every state. They are funded by the same group that the Senior Medicare Patrol is funded by.
Okay.
And therefore it's free and they give objective advice. And I know a lot of people use agents and brokers that they've used. And some of them probably are honest. But I always tell people, go to SHIP, make an appointment, sit down with a person who's not selling you anything,
Right.
just
right.
wants to give you your best coverage for 2022. And you have to do it because you don't want any surprises. You have to remember that there are 23 Part D drug plans next year. 23.
Wow. Wow.
There are 66 Medicare Advantage plans next year in New Jersey.
Wow.
Now, they don't all cover the entire state.
Right.
A lot of these plans only cover certain counties. So with all these changes every year, unless you do a comparison, you're not going to know if you're in the best plan. And
Right.
not only just the quality of the plan, but the cost of the plan. And, some people might say, well, if I can get Meals on Wheels after I come out of a hospital, or if I can get, transportation costs because I don't drive and they'll take me to and from maybe a Medicare Advantage plan would be good for me.
Right.
So everybody is different. So, I tell people it depends on your personal situation and whether you should be an original Medicare or in Medicare Advantage plans. Those are the two options that most people have.
And I want to point out, it's important that if you go for advice, SHIP is neutral and Medicare.gov is neutral. Even if you search, like I did the other day, you search Medicare Advantage or Medicare Open Enrollment, other things pop up that are really ads or the one particular plan, one particular insurer. So going to Medicare.gov or calling SHIP are neutral. They're not choosing one plan over another for you.
That's
It's up to you to
correct.
choose.
That's correct. And you just have to be aware that certain plans are better for you and certain plans may not be good for you.
Right.
So, and it depends on your financial situation too.
Right.
If I'm on Social Security only and a fixed income and I cannot afford to be an original Medicare because many of these plans, the supplement plan goes up every year by age. And so it could be as if I hit 80, I could be spending $300 a month just for the supplement plus the Part B premium. So it may be better for me to say, I don't mind going to a network.
Right.
And I don't mind following the other rules, and I might be able to save a little money. Because remember, in a Medicare Advantage plan, you don't need a supplement plan. And most plans, except the ones that are usually targeted toward veterans, they almost all of them have drug components to them, just like Part D.
Okay. And what's right for you might not be the right plan or the right option for your friend. So it's what's best for you. That's important to remember. Okay. So what should beneficiaries know about open enrollment this year? We have until December 7th to decide. How is it going to look different in 2022 than in previous years?
Well, some of the changes that we've noticed is that there are a lot of plans that are terminating.
Oh.
Like Horizon Blue Cross Blue Shield is now partnering with Hackensack Meridian and RJW Barnabas to come out with a plan called Braven Health.
Okay.
So if you're in Middlesex County, which we're calling from, right? This is Middlesex County. You cannot be in a Horizon Blue Cross Blue Shield plan. They've dropped all those plans. You can only get Middlesex County for Braven if you want something like that.
Okay.
Plus, a lot of plans terminate.
Okay.
And they put you in another plan. And you might say, well, and usually you get a letter. Oh, we're terminating our plan. You have a right. You should look into plans and change plans, but a lot of people don't. And they may be surprised that they're put into a plan with a much higher premium than what they were paying before because they didn't bother to read the information or to change plans. So that's what happens. And remember, every year these plans change. You know, last year they allowed Medicare Advantage plans to start adding what we call extra or supplemental benefits, and I mentioned a couple of them, okay? So if these extra benefits, like eyeglasses, hearing, dental, transportation, Meals on Wheels, safety bars, and over-the-counter cards. Some plans are giving you like $50 a quarter to spend over the counter. If these things make some sense to you, then you have the option to switch to that plan. But you have to look at the plans. Everybody offers different benefits. And the only way you find that out, now you could get a chart like I have and call up every company, 66 plans, you know, and say, hey, what are you offering? No, go to the Medicare Plan Finder and you can actually filter the plans by saying, I need a plan with transportation, or I only want a plan given by a certain company. You know, so you can do all these types of things on and the Medicare Plan Finder, if you're used to it, it's not too difficult. But I understand that it may be difficult. I use it all the time, so I don't find it daunting, and I can do it quickly. But some people can't, and that's why we have the SHIP program out there. And I've given you the number, so hopefully we can give it to the audience.
We will put it up there. So everybody should look to make sure they didn't get a letter, or look for mail if you got it, open it, read it. And if not, people should still check and see if their plan is changing. I think like Unicare is a Part D drug plan. I know they're terminating. So they were sending a letter out, hey, we're ending. If you do nothing, you're not going to have drug coverage next year. So you have to really pay attention to your correspondence. Now, unfortunately, you're inundated every open enrollment with correspondence from different companies, different plans. I tell people, throw them in the garbage. Talk to a SHIP counselor. I happen to also be a SHIP counselor. That's why you know all 66 plans. So are there any changes in Medicare overall that are coming up for 2022 or through the plans?
Not really anything spectacularly different. You know, the real difference is every year is what is added or what's changed, what's terminated, and what the costs are. That's what you have to look at.
And then, you know, for people who are starting to look at it, do they need to change their Medicare supplement or Medigap coverage during open enrollment?
Now remember when you first enroll in Medicare, you have two options. Do I want to stay in original Medicare, which doesn't cover everything, so I buy a supplement plan and I buy a separate Part D drug plan, or do I want to go into a Medicare Advantage plan, If I have original Medicare, you have to really buy a supplement. You don't have to, but you should buy a supplement because Medicare pays 80%, and that 20% could be a significant number. So Medicare supplement plans, what they're called, they don't have an open enrollment period. You can change Medicare supplement plans anytime you want. Here's the problem. When you first enroll in Medicare and you have Part B, which is the outpatient coverage, you have 6 months to get a supplement plan, and they can't turn you down for any reason.
For 6 months?
6 months. Even if you're dying, they have to accept you, Once that 6-month period goes by, after you have Part B, you no longer have a guaranteed right. So if you want to switch supplement plans to another company that might have a cheaper premium, or you want to switch lettered plans, you know, if they go from A to N, you can do that, but you better make sure if it's after 6 months that they will accept you. Because they could then underwrite and look at your risk factors and say, well, you know, you have a heart condition. We're going to charge you more if you want to switch into our company plan. Or we'll have a waiting period for you, like 3 to 6 months. So you have to be very, very careful. But you really need a supplement plan with original Medicare because if you get sick and you're an inpatient, that 20% extra cost can really add up.
And can you go back and forth if you're original Medicare with a supplement and then you decide I'm going to do a plan? Then after a year or two you say, you know, I don't like plan. Can you go back to original Medicare?
Here's the rule. If I go into a Medicare Advantage plan for the first time,
Right.
I have a year to say, oh, I like this, I don't like this, and then I can go back and I have a guaranteed right to pick up that supplement. But it's only during the first year that you have a Medicare Advantage plan.
Okay.
Most people that I speak to have been in Medicare Advantage plan for years. They don't have that right anymore. They can be subject to underwriting and risk.
Okay.
And that's why you have to make sure. I tell people, if you want to leave a Medicare Advantage plan, that's fine. I have no problem with that. Just make sure before you drop your coverage that you can get a supplement plan that's not, within your financial means.
Yeah.
Because they might not accept you. They don't have to.
Okay.
Once that guaranteed right is over, they can say, we're not taking you.
So people really do need to do their research, pay attention to this.
And, it's hard for some people to do the research. Let the SHIP program do the research for you.
We'll have that SHIP number up on the screen for everybody to see.
Right.
So now, Charles, I want to move over to Senior Medicare Patrol. And I know they're particularly focused on scams and fraud, correct?
Correct.
So can you remind our audience of what Senior Medicare Patrol, SMP, is and its role?
Yeah. Well, we're a federally funded program. Every state has a Senior Medicare Patrol. And basically our job is to assist and empower beneficiaries to prevent, detect, and protect Medicare fraud, waste, and abuse. And people don't realize how significant that is. We lose, according to estimates I've seen, Medicare loses $60 billion a year.
Wow.
$60 billion.
Wow.
And if you throw in Medicaid and private insurance, the FBI estimates you lose $1 in every 10. And that's $250 billion a year.
Incredible.
And, I do a lot of presentations. I do educate by outreach. And I say, who's paying for this? You are. We all are, because it comes out of our tax dollars.
Okay. So if I'm not the victim of a direct scam, it's still all of the scams
you.
are.
Absolutely.
Wow.
And it raises the overall cost
Right.
of Medicare providing services.
Right.
If we had no fraud, that $60 billion would be in the Medicare program, helping to pay for premiums and co-pays and deductibles, but we can't. And that's why the premium for Medicare is going to go up every year.
Okay.
And the other costs. So it's just part of fraud.
Wow. So we know that Medicare scams have been a problem for a long time, and that SMP does a good job of educating people about the scams. Can you tell us what are some current ones, maybe what's new out there in scam world?
Well, during the pandemic, every time we have something, an emergency or something difficult, there's going to be new fraud. So this year we've seen a lot of vaccine-related fraud.
Yes.
Where people are selling fake drugs, fake cures, fake masks. So we tell people, don't go online and don't think you can get the vaccine delivered to you at a cost. Not available that way. If it is, it's a scam.
Right.
Okay?
Or I saw getting a reward, get a gift card if you had the vaccine.
That's right. And we've seen the most recent COVID-related vaccine scam is the vaccine survey. You get an email, you just took your vaccine. If you fill out this survey, we'll give you $50. And it looks like it's coming from Pfizer or Moderna. It's total scam. They are not doing any legitimate surveys. You will never see the $50. And of course, what do you think they ask for?
Social
your
Security
Medicare number, your Social Security number. All they want is your personal information. That's it. It's not anything hard to figure out.
Okay.
I mean, with that information, they can either bill Medicare or sell your number or personal information to people who will use it. So those are the kind of scams we've seen since the vaccine started. And we see the old stalwarts all the time. Genetic testing. The new variation on genetic testing is you get an email and it says, your doctor, in quotes, your doctor has ordered this test for you.
Okay.
And you say, wow, okay. My doctor knows what he's doing. I better take this test. Well, if you ever called up your doctor's office, he said, what, are you crazy? We have never heard of that before. We didn't order anything. But it sounds like it's coming from your doctor. They check with your doctor. They know your name. They know your address. And you say, I'm signing up for a genetic testing. Of course, total scam. Medicare will deny it because it's not medically necessary, and guess what? You may be on the hook for anywhere from $9,000 to $13,000 for a genetic test. So you have to be very, very careful. And then, of course, we always see the usual braces, neck, ankle, back. People get delivered to them. All these braces, they never ordered them.
Oh.
It's not medically necessary, but someone is billing Medicare because they're sending you braces. And these braces can come off the shelf. They're not customized. They don't even fit you, you know? But Medicare will pay for them because they don't know it's a scam. They don't know you didn't order it. So that's where the Senior Medicare Patrol comes in. If you, number one, read your Medicare summary notice or you think you're involved in a scam, call us. We're free.
Okay.
We have 30 to 40 trained volunteers. We assign volunteers to beneficiaries, and that volunteer's job is very simple. Resolve the issue.
Okay. So when you look at your Medicare summary notice, you should look and see if there's anything in there that looks strange that your doctor didn't order, and also be aware of people calling saying, oh, your doctor ordered this test for you when your doctor never mentioned it.
Telephone calls are one of the biggest ways people get scammed. And I tell people a general rule is this. Most people have a screen for their telephone. If you don't recognize the number, even if you're lonely and isolated, do not pick up the phone.
Right.
Because remember, these calls are computer generated. When you pick up the phone, the computer says, oh, we got a live one here.
Okay.
Even if you hang up later, it was recorded that you picked up the phone. So I tell people, okay, if you pick up the phone and make a mistake, hang up immediately once you realize it's a scam.
Right.
Otherwise, don't pick up the phone. I haven't picked up a phone in 5 years. I let my wife do all that. So, you know, it's because I know. And I educated her. I said, if you don't recognize that number, honey, please do not pick up the phone.
Okay.
And really, because the only way really to protect yourself, don't ever use the internet. Don't ever pick up the phone. But you can't live like that.
Right.
You just have to take steps to protect yourself at all times. And, you know, one of the things is you protect your Medicare card, you read your Medicare summary notice, and you report the fraud. That's the steps you can take to help fight Medicare fraud.
Okay. So, Charles, all of this information can seem complicated, especially right now when people are looking at all of the information at once. If people have questions, they can get help from the SHIP program, as you mentioned.
Right.
So will you tell us one more time, how do they get in touch with a SHIP counselor?
Okay, well, you know, what we're going to put up is the state SHIP program. When you call them up, they're going to give you the number of the county because every county has its own SHIP counselors. But I am advising people, don't wait.
Don't wait.
Because they get very busy during open enrollment. Remember, it's only 2 months and days. And they're going to get a lot of people who, and right now, many of these offices are not live anymore because of the pandemic.
Okay.
So you may have to go out of your way. Some counties may be taking live people. Some county may be taking only Zoom or email or telephone. So I would encourage you, call SHIP now.
Okay.
Don't wait and make an appointment. Call up, then they'll give you the county number. You call up the county number, and hopefully you can schedule an appointment with a SHIP counselor. And that SHIP counselor has been trained. They know, and believe me, I just went to some update training as a SHIP counselor. Not only are they trained initially, but every year there's update training. And you have to go to this update training to stay qualified as a SHIP counselor.
Okay.
So they are very knowledgeable about Medicare. And they have the charts, like I brought a couple of charts here. They show all the Part D plans and the Medicare Advantage plan. So they have all this information. Let them help you.
Okay.
They're free.
And they're ready now.
And
it's
they're
enrollment
ready.
time.
And
Don't
they're
wait
not,
till December 7th.
All they're allowed to do is give you advice.
Right.
They don't say you must join this plan.
Right.
But and you should take advantage of that program.
Okay.
It's federally funded, just like my Senior Medicare Patrol, from the same agency, the Administration for Community Living. Why not take advantage of them?
Good advice. So let me ask you, Charles, you are probably one of our most frequent guests. How many times have you been on the show?
I think I've been on the show maybe a dozen times.
And how many years have you been coming on the show?
Oh, gosh. 8, 9, 10 years, I guess. It's been a long time.
So I don't know if you knew, this is our 10th anniversary, 10 years of Aging Insights.
Really?
So yes, and while people know your face and mine, they don't know who's behind the camera, and we want to thank our friends and the team at PCTV for 10 years of helping us put on this great program and bringing it to you, to your living room, to your laptop, wherever you're watching it. If any of you would like to come out from behind and take this, I wanted to thank you from me, from Sue Brooks, from Melissa Chalker and Grace Egan for 10 years of helping us put together this great program. We really appreciate it. You guys make it easy. Thank you.
Thank you.
Thank you for watching this episode of Aging Insights. To find out more information and to view previous episodes that we've had for the last 10 years, please visit our website at www.njaaw.org and click on Aging Insights. Aging Insights is brought to you with the support of our funders, supporters, and viewers like you. And I'd like to thank our partners here at PCTV for helping us to bring this program to you for 10 years now. If you need information or resources about services in your area, please contact your county office on aging. Their phone number can be found on our website, or you can call the state hotline toll-free at 877-222-3737. New Jersey Advocates for Aging Well wants to remind you to stay safe during this pandemic and to please reach out to older adults who may be isolated, lonely, or need of assistance at this time. And don't forget to like and subscribe to our show on our YouTube channel. Thank you, and join us again next time for Aging Insights.